In our trauma division, we noticed that we were seeing a fair amount of domestic violence, and in particular, pregnant domestic violence. And this is an important issue, particularly now when during the COVID pandemic, there's reportedly an uptake of intimate partner violence. So we wanted to study this issue in this particularly vulnerable population of pregnant trauma patients. We did an analysis comparing pregnant trauma patients to pregnant patients suffering intimate partner violence injuries. And we found important risk factors in trauma patients that may point towards domestic violence. And these include multiple injuries, injuries of the head, including face, neck, and scalp, and then single or multiple abrasions on the body. We also found that there may be important socioeconomic factors, including Medicaid and self-pay payer status. Ultimately, we concluded that we should consider improving our screening methods on the trauma side of patient care early on in their ER course, as that's where most of their care will happen, because most of these patients will actually get discharged home and not admitted to the hospital. There are several screening tools that have been studied in the trauma literature that trauma centers can employ. And at our own institution and division of trauma and acute care surgery, we hope to begin screening more effectively our pregnant trauma patients based on some of the outlined risk factors we identified. Well, from our study, I think just having down what to look for, what should trigger somebody to get screened. Whenever you have a screening tool, you have to say, is this a screening tool that I'm going to screen everybody on? Or is there a particular population that gets screened when certain triggers are met? I think we've identified certain risk factors that should prompt screening. It's putting the spotlight on what we can do and what we should be working towards in terms of helping our patients that are suffering from domestic violence, shining a light on the fact that what does it mean that we just give a patient that screens positive resources, and then exploring that further.